Hello and welcome back. In chapter 14, we're talking about the personal context of later life. We're talking about physical, cognitive, and mental health issues as we age and we get later in life. So, the demographics of aging. Better healthcare and low childbirth mortality rates for women is responsible for the large population of older people in the United States, right? Older population is expected to increase due to the differences in medication, the difference in healthcare, the differences in the more knowledge we have about our bodies and whatnot, right? But it also puts a strain on the social service systems and the healthcare system, right? That population pyramid that we're talking about here is used by demographers to illustrate population trends. What will older adults look like in the coming decades, right? We're better educated, like I just said. 75% will have a college degree by 2030. Higher education leads to increased longevity by means of healthier lifestyles. In Japan, 2025, adults over 65 will outnumber children 2 to 1. So when we talk about longevity, the number of years a person can expect to live, this is determined by genetic and environmental factors. There's three types of longevity: average life expectancy, age at which half people are born, in a particular year will have died; useful life expectancy, number of years a person is free from debilitating chronic disease and impairment; and maximum life expectancy, the oldest age to which a person lives. So heredity is a major determinant of longevity. Environmental factors also play a huge role in longevity. They come about disease, lifestyles, toxins, social class, healthier lifestyles, reduce disease. Ethnic differences exist in life expectancy. Latino Americans have higher life expectancies than European Americans at every age, as do African Americans once they hit age 85. Women's average longevity is about 5 years greater than men at birth. It narrows to 1 year by age 85, mostly seen in developed countries. Men have greater risk of dying from the majority of the top causes of death at every age. They're more susceptible to infectious diseases. Two major types of theories explain why people grow old and die. So we have program theories, the biological clock in which cells start to self-destruct. Or damage or error theories, where this is the wear and tear theories, suggest that the body gradually deteriorates and finally wears out. Accumulated from from free radicals over time. Chemicals are produced randomly during normal cell metabolism and bind easily to other substances within cells, resulting in aging. Cross-linking, the random interaction of some proteins with certain body tissues, or telomeres, type tips of chromosomes that shorten and break with age as we age. So let's talk about physiological changes. Changes impaired in neurons' ability to transmit information, leading to decline in personal functioning. Neural fibrilla tangles. Masses form when fibers and axons become twisted together. Um, large numbers of these are associated with Alzheimer's disease. Some dendrites die and others grow. Neuritic plaques, um, change produced when damaged or dying neurons collect around the core of a protein. Levels of neurotransmitters decline with age, believed to be responsible for changes in sleep and memory in old age. Neuroimaging is important for understanding normal, abnormal cognitive aging. Structured neuroimaging, functional neuroimaging is an indication of brain activity. Cardiovascular and respiratory problems increase with age. Cardiovascular disease risk increases. Stroke or cerebral vascular accidents caused by an eruption of blood flow in the brain due to blockages or hemorrhage in cerebral arteries. Transient, transient ischemic attacks. These are eruptions in blood flow in the brain. We also talk about vascular dementia, a disease caused by numerous small CVAs. Sudden onset may progress slowly. Chronic obstructive pulmonary disease, most commonly form of incapacitating respiratory disease among older adults. Age-related structural changes occur in the eye, decreasing the amount of light that passes through the eye. Ability to adjust to change in illumination decreases. presbyopia, difficulty in seeing close objects closely, abnormal structure changes in eye causes diseases, cataracts develop in the lenses, pressure of fluid on the eye leads to glaucoma, changes in the retina can also occur. People of all ages should avoid loud noises. Headphones at a high volume are a danger, especially when exercising. Presbycusis, reduce sensitivity to higher pitched tones. It happens in approximately half adults by the late 70s. Hearing loss can cause emotional and interpersonal problems. Health issues. So half of the United States adults have a chronic health condition. Diabetes occurs when the pancreas produces insufficient insulin. The majority of older adults with diabetes have mild problems related to disease. Older adults report taking longer to fall asleep and falling more negative after a night of inadequate sleep than the younger adults. Disruptions to the circadian rhythm can cause problems with attention and memory. Older adults need to have a well-balanced diet. Psychomotor speed and reaction time is impacted. The speed in which a person can make a specific response. Right? People slow down as they get older. Do you think older adults should be allowed to have driver licenses? Again, we've always had that question about our grandparents. They get a certain age or whatnot. Do they have the ability to drive and handle the reflexes that's needed when they drive or have to drive a vehicle from point A to point B? Decisions are about at-risk drivers should be considered by more factors than just age or a medical diagnosis, right? It's important to look at all the various different things that can happen from individuals as they age and they drive or other factors that they have. Working memory, the process and instructions involved in holding information and simultaneously using it for other functions, right? Generally declines with ages. Older adults activate the prefrontal area associated with working memory, even on easy tasks. Study of memory focuses on two types: explicit memory, deliberate and unconscious remembering of information learned and remembered at a specific time, and implicit memory, the unconscious remembering of information learned as an earlier point in time. So, what types of memory changes in older adults? Perform worse on tests and episodic memory. Age differences smaller, but still present on recognition tests. Somatic memory difficulties usually seen in people with dementia. The neuroscience shows that the structure changes in the brain underlie changes in memory. Is forgiveness always indicative of something worse, right? So an array of tests used to diagnose normal and abnormal memory changes determine whether memory problems are interfering with everyday functioning. A thorough examination is needed once a problem is suspected. So again, that your forgetfulness can play a role in those things. And many memory diseases progress slowly. Some people need to help remembering due to normal age-related memory changes, and others need help because they are experiencing greater than normal memory changes. Explicit external interventions are used most frequently by for normal aging memories problems. And creativity in adults is the ability to produce work that is novel, high in demand, and task appropriate. So there's four characteristics of wisdom. Deals with important or difficult matters of life or the human condition. True knowledge, judgment, or advice. Knowledge with extraordinary scope, depth, and balance that is applied to specific situations. Well intended and combines the mind, and character. So research suggests that no association between age and wisdom. Whether a person is wise depends on whether he or she has extensive life experience with the problem and the prerequisite personality and cognitive ability to deal with it. What helps a person become wise? Well, general personal attributes such as mental ability, specific expertise such as mentoring, facilitative life context such as education and leadership experience. So let's talk about depression. The rate of severe depression actually decreases with age. Average age of onset is early 30s. Depression is in older people diagnosed by looking at feelings and physical changes. Feeling of dysphoria is usually the most prominent symptom. Physical changes include appetite, insomnia, and trouble breathing. What causes depression is biological or physiological processes such as neurotransmitter imbalance. Psychosocial factors such as loss or internal belief systems play a role. Internal belief systems with what one tells oneself about why certain things have happened to them. Medications can alter balance of certain neurotransmitters. For severe depression, SSRIs or HCAs or MAO inhibitors are prescribed. Psychotherapy is also used as an alternative in combination with medication, behavioral therapy or cognitive behavioral therapies. Dementia or Alzheimer's disease. Let's discuss that shortly, briefly. Dementia is a family disease involving serious impairment of behavioral or cognitive functioning. Alzheimer's disease is the most common, affects all socioeconomic, ethnic, or racial groups. Approximately half of people of 85 years of age or older have Alzheimer's. What are the symptoms of Alzheimer's? Gradual declines in memory, attention and judgment, confusion at times, difficulties communicating, decline in self-care skills, inappropriate behaviors, personality changes, incontinence. The rate of deterioration varies from person to person, but usually is around 12 years from onset of symptoms. Alzheimer's disease only certainly diagnosed through brain autopsy after death. So you only can get a definite autopsy or certain diagnosed through the brain is after death. Involves documented memory of the amyloid plaques and the neurofibular tangles. What causes Alzheimer's disease? Early onset is before age 60. It tends to run in the family. Autosomal dominant inheritance. The presence of certain genes means that there is a 100% chance of a person eventually getting the disease. A later onset is after age 60, may be linked to genetic risk, most commonly related to amyloid plaque formation. Neuroimaging helps identify certain changes with Alzheimer's. Currently, there is no cure or preventative measures for Alzheimer's. Few medications show promising results. Behavioral education interventions are in place, like spatial retrieval, or some programs bringing older adults and preschoolers together to learn. Parkinson's disease. This is a brain disease known for its characteristic of motor symptoms, very slow walking, difficulty getting in and out of chairs, and slow hand tremors, caused by disease of decrease of dopamine. Medical and surgery can cause a deterioration of neurons that release dopamine. And finally, chronic traumatic, I can kill this word, NC play, kill this word all the time, guys. I apologize. Encephalopathy is a form of dementia caused by repeated head trauma, such as concussions. It occurs as a result of repeated brain trauma in sports and military combat. 14 to 15 brains for former NFL players show evidence of what we call CTE.